I used to get this condition a lot, but not as much as I used to. It's what I call the disability for kids based on asthma. Don't get that as much as I used to, but there was a period of time I used to get it a lot. And you'll get a parent that comes in and will say, oh, my child's asthma is all the way live. And I've told people repeatedly, historically, I don't deal with asthma cases for kids. Why? Because they're hard to prove. And they're hard to prove because let's go down the line. First thing I'm going to ask you is, one, what are they taking? I already know you're going to tell me they're taking an inhaler and they have a nebulizer. Oh, well, everybody that you run across at kids at that particular point gets that. Go a little bit further. Are they taking, corticosteroid shots? How often are they using the medication? Are they using it more than the prescribed amount of times? How many asthma attacks are they having? This is where it's important, where you should pay close attention to the number of times they have an asthma attack and keep documentation of it. Are they going to the hospital? Now, I can't tell you the number of times people come to me and they say, a bunch of times. What is a bunch? I'm going to tell you, attorneys and representatives, we deal in absolutes. We don't deal in generalities. So don't sit here and tell me, when I ask you the question, how often are you giving the inhaler? Oh, I'm giving it a lot. I don't know what a lot means. What's a lot? Well, more than what's prescribed. I still don't know what you're talking about. And I'm going to play dumb because the court is going to, and I always look at this from the standpoint of the court wants to narrow down and pin down how many times is this child using the inhaler? And are they using it more times than they normally would? How many times is this child gone to the hospital? Not just ER, but ER and admissions. How many days has the child missed school because of asthma? How many times have you had to pull the child out of school because of asthma? How many times have you had to go to school later because the child has had an asthma attack? These are all things that you need to know. Are there any restrictions on the child's ability to do any types of activities? What types of things trigger it? Are they frequent attacks? I know all this sounds like I'm pulling out my thigh when I'm saying it, but it's important for you to understand this. When you're trying to elect disability benefits on asthma, asthma falls into one of those categories, and if you've watched any of my other videos, you've heard me talk about, there's a few health conditions out there that there's a general attitude that if you follow the treatment that you're following, you should be all right. High blood pressure, diabetes, asthma is one of them, and epilepsy. Those are my big four where I always say, if you're doing the things you're supposed to do for treatment, in theory, you should be fine. If it's not working, it either usually means one of two things. Your condition is worse than what it is, or you're not doing what you're supposed to do. Most times people fall into you're not doing what you're supposed to do category. So I don't want you to be in that category. So you want to be able to go before Social Security and say, I'm following the treatment regimen for my child. Despite my best efforts, my child is still having more asthma attacks than normal. We're using the inhaler more than we normally do. We're going to the ER and admissions more than we can. But you got to be able to spell that out. And here's the other thing I want you to know. There is no magical number. So for those of you who are like, so how many hospital visits do I need? I'm going to tell you, don't wrap your brain around the number of hospital visits. It's really about the number of visits, the frequency, and how long they've been there. Same thing. Well, how many times should I say that they've been having attacks during the day? Don't do that. Okay? The reality is the court is going to want to know specifically. Here's where it gets funky. If you sit up here, and I've seen people try it, they'll try to make it seem like the situation is worse than what it is, and then the medical record says something totally different. Now you've got a conflict. And I'm going to tell you, Social Security is going to always resolve in favor with regards to the doctors, for the lack of better words. Because if they think that you're trying to make the situation seem worse than what it is, it's not helping your condition at all. Bear this in mind. Keep these things in the back of your mind. When you're trying to get disability benefits for your child based on asthma, it's important for you to follow the treatment regimen as closely as possible and be prepared to explain if there's any significant abnormalities, meaning, are we using the medication more than you normally would? Are you going to the hospital more than you normally do? Are you having to pull her out of school or he out of school more than you normally do? Be able to describe all those, so this way you can paint a good picture for Social Security.